This is Dr. Bhupesh once again from Dr. BKM Institutes, and today we are going to discuss the letter. I haven't seen the letter today, so I want it to be like the way it will come to me in the exam. So I'm just gonna again replicate the same things which I always say. First of all, we need to find to whom we are writing the letter. This is the most important aspect, to whom we are writing the letter. So in this case, you are the charge nurse at the hospital where Mrs. Goldstein was admitted 3 days ago for the treatment of a dislocated elbow. So I am a nurse, so I have to write the letter on the behalf of the nurse for a patient who came for the treatment of dislocated elbow. Using the information in the case notes, write a letter to the supervisor at the Eventide nursing home. So that is the main thing that we have to consider in this particular letter, that the patient was admitted for 3 days, and the major thing that we have to be very careful about this address is residential aged care, because when we are writing to the residential aged care, it is very obvious either the patient is going for the first time to the aged care or patient already belongs to aged care. So how would we come to know whether patient is already residing in the aged care or is he going for the first time? क्योंकि अगर यहाँ पे सिंपल घर का एड्रेस होता, if there would have been a simple home address, that means the patient is going back home, but the address has been given residential aged care, so that means first thing patient is aged. Second thing, residential means that is a place where the residents are. That means the patient either belongs to this residential area or the patient will be going to the residential aged care after the discharge for the first time. If he is going for the first time, अगर patient पहली बार जा रहा है तो इनको social history नहीं पता होगी patient की, then they might not be aware of the social history of the patient. But if the patient already is a resident of residential aged care, then they would be knowing about the social history and medical history. That is what we say is the discharge back letter. So how would we come to know that patient is a permanent address or other patient belongs to that particular thing, area or not, belongs to this residential aged care or not? So I will go on the front page. I will try to check the address of the patient. So that says full time care at Eventide residential aged care. That means patient already is taking full time care from this residential home and the address is same. So that basically implies that patient is part of this organization. In this particular letter, it is very easy because it has been given here for discharge back into permanent full-time care. Over this, it is given, but in normally in rest of the letters, apart from this letter, you will have to check the address of the patient over here. So that means what will happen in OET examination, in this letter, these guys have made it very simple for you, that they have given you at the back only that write a letter to the supervisor of the residential aged care, and that residential aged care supervisor knows that the patient is coming back. So you have been given all the information very easily that patient is being discharged back into your care, back into the care of residential aged care. But you have to understand in the original exam it can be there, it might not be given over here. So you have to be, it might not be given over here, so you have to identify. So always read the address. This is very important thing that I am telling you. Always read the address when you are writing any letter of OET, because if the address of the person to whom we are writing and the address of the person matches, in this case it matches Eventide residential aged care, in this it is the same Eventide residential aged care. So you would be able to identify that this is a discharge back letter. I hope it is okay with everyone. So what I'm gonna do, I'm gonna stop this recording. This is a very small recording of like 2-3 minutes, but I would like to upload this on the YouTube again, so that you will all have a clear idea. And then I'm gonna restart the letter right from the scratch. So I'm holding on to the recording at the moment.